I'm curious about to learn how new technologies and engineering tools help patients and medical care and how these tools can be used to improve quality of life. My name is Mohammad Moghimi. I'm an assistant professor in the Department of Biomedical Engineering at Wake Forest University School of Medicine in Winston-Salem, North Carolina.
Your recent publication in NPJ Biomedical Innovations about a battery-free chipless patch that analyzes skin and possibly skin cancer. Can you tell me more about that?
We developed very thin and non-invasive wireless battery-free patch that can place on a skin and on lesions to measure electrical properties of the tissues. There are clinical studies show that cancer tumors have different electrical properties than normal healthy tissues. And this device can distinguish electrical properties without any battery and through wireless through communication with personal electronic. So this device can alert patients if they have any risk of melanoma or any other type of skin cancer, and it can accelerate the diagnosis, help early detection of the tumors. And studies show also that early detection increase the chance of successful treatment for a skin cancer, and that device is essential for early detection.
There need to be a mole or something visible in order to detect it?
Usually they are pigmented or they have different shapes, different images, and you see some abnormality on a skin. The only challenge is whether you find it's only just pigmented mole or it's a cancer, or it has potential to transform into a cancer. So that's the important thing. So when we see these abnormalities on the skin, usually we don't know which one is benign and which one is cancerous. So that's the device. It's going to help to identify risk for having the cancer.
Why did you decide to work on this?
My background is electrical engineering, all of my education, but we are always making devices for my PhD and then postdoc. We're trying to use these engineering tools and electrical engineering circuits and sensors, how to help patients. So melanoma, we were doing some research for microscopy, especially for clinics to do that. And I realized that many of these equipment are designed for clinics and for specialists. And there is opportunity for patient to find risk at home for primary care doctors to evaluate the lesions. That was my motivation to make a device from very simple sensors and electronic we have to make a device that people can use it in primary care doctors and use it at home and detect these abnormalities within a skin and refer it to a specialist for treatment. So that was the main motivation, combining engineering background with needs with the medical needs.
And where is this in the process of being available to a patient?
We make a prototype. We did some preliminary result. Right now, we're working with Comprehensive Cancer Center at Wake Forest University School of Medicine to do a clinical trials. So I just received some email today that they are approved and we're going to start very soon clinical trial on patients in the clinical dermatology department here. And then from the first clinical trial, we do second clinical trial with larger number of patients. And hopefully after that, we can get the FDA approval and go for the market.
Is this considered a medical device?
Yes, in some sense it is, but what we're trying to do is something, we make some over-the-counter device after getting approval from FDA that people can use it at home, while doctors like primary care doctor or a specialist can use it to analyze the lesions that they are suspicious already. So it would be useful for patient at home and in the clinics for doctors.
It's so interesting that cancer cells have different energy that they produce.
Cancer cells, they have different properties, electrical properties. So what we do with this? So we call it bioimpedance of the tissue. So what it means is when you have electrical current passing through tissue, if you have a cancerous tissue and you have a healthy tissue, the electrical current through them would be different if you apply the same voltage to both of them because the impedance is different. The reason for that is when we look at the cancerous tissue, there are more perfusion, more blood flow around that. There are more ions. pH is different. All of them translate to change in electrical properties and how electrical current pass through the tissue. This device is intended to wirelessly get energy from personal electronics, for example, cell phones, get some energy, inject very small current through the tissue and see how much current is changing, and then send back the signals to the cell phone. So we can see how they react to the electrical current and how these devices operate.
Can you explain more about how cancer tumors or cancer cells are different and how they're detected from your device?
One of the things that is important if you look at cancerous tissue versus healthy tissue, see the density of the cells are higher on the cancerous tissue. If we just want to look at the electrical properties or how current passing through tissue, when you have more cells in the small area, in the same area, so they resist differently than when there is a sparse amount of cells. So the density of the cells that contribute to the amount of electrical property. Also, the ions that are there during the cancerous tissue, they absorb more nutrition, more blood, and they're going to develop fast, and that change the electrical property. And usually, based on many clinical studies, cancers show higher conductivity. That means the current passes through the cancer tissue easier than healthy tissue. That's one way to detect these cancers and we find abnormalities.
I mean, there are a number of cases, right, where people go to dermatologists and say, "Oh, I have this thing. It looks like it's fine. No worries." Then years later, maybe it becomes something that is a problem and it's much more serious at that point. It sounds like often it can be difficult for dermatologists even to be sure about whether something is cancerous or not.
Dermatologists have more equipments to evaluate a lesion. However, if they have additional information about the lesion, that would be helpful to decide whether they want to do biopsy or don't do biopsy. So for biopsy, they remove piece of tissue from the lesions and put it under microscope and see how the cells look like, whether they are cancerous or not from the imaging cells. However, they have different equipments. They use imaging technique. They look at the colors. They look at the border of the lesions. They look at all of these parameters and they decide whether they cut the tissue or not. However, the biopsies are not very successful. Sometimes specialists do multiple biopsies until they find the lesion or the cancerous lesion. So this device helped them. That's one of the discussion we have with dermatology department is they look at the suspicious moles that they have or lesions on their skin, look at multiple of them, and then they can measure the electrical properties of them and then have more information which one has a higher risk to be cancerous, and then they conduct the biopsy. That's one of the application for this device for a specialist to reduce number of unnecessary biopsy.
It seems like instead of then having to do the biopsy and then the extraction, they could just do the extraction.
Usually they do incision for biopsy. Even there are some newer technologies that they don't need to do. It's called virtual biopsy. But for the conventional biopsy, what they do is they remove tissue, they put it under microscope. But they have to do multiple lesions that are high risk. But still, it's difficult to verify without removing or putting under microscope. So this device measure let's say they identify 5 high risk lesions. And then between those 5, you can do 1 or 2 have higher risk for melanoma or skin cancer or different type of skin cancer. Then they cut those ones. So it increase the success rate for biopsy and reduce unnecessary amount of biopsy. And biopsy is not also desirable for the patients. It's difficult. They cut the tissue. You want to have less incision into a skin.
Are you going to be continuing to work on this further, or is there something else then that you're also working on?
We are working on this device. We are working on 2 ends. One is from the engineering standpoint to optimize the device, make it easier to use for patient, and also be working on clinical trials. And in the next couple of years, we will have clinical trial for the skin cancer patch. But in addition to this device, we also make another device that's to address pediatric hearing loss. And it's also a small patch that attached to a skin behind the ear and absorb sounds from the environment and enable, especially pediatric patients that they cannot do uh, surgery, hear sounds. So this is very interesting because you don't need surgery. It's non-invasive, and it addresses conductive hearing loss, which is very common among pediatric children, especially younger than 5 years old. The problem with hearing loss in earlier stages, when children don't hear, when they are young, they don't adapt. Their brain don't adapt to the naturally occurring sound in the environment, and they may delay their language and speech development. And you want to just hear them as early as possible to adapt and develop communication skills. So specifically for conductive hearing loss, that patient don't have external ear, or the ear is blocked, or they have some anatomical problem with the middle ear bones. These things are difficult to do surgery to conduct corrective surgery. When patients are 1 year old, 2 year old, it is very risky for them. There are also some implantable hearing aids that implant into the skull. Those are for adults, it works very well, but for patients, especially younger than 5, it's very difficult to do those surgery with invasive procedure. So we come up with device. Thank you to microelectronic and nanoelectronic, then you can have electron, very small area, very thin, and put it onto a Band-Aid. And this device attached to a skin behind the ear has a very small microphone to absorb sounds from environment, and through the bone, enable patient to hear sounds.
That's wonderful. It sounds like you're doing a lot of interesting projects that can be so helpful to people. Do you enjoy your work?
I love doing this, and the reason that I wanted to do research and chose this career path was, again, to use whatever we learn in engineering and a lot of technologies out there to help patients and improve the quality of life. I think that is very rewarding.
Dr. Moghimi, thank you so much. It was a pleasure hearing about your work, and I know it's going to be helpful for so many people. Thank you.
Curious by Nature is a production of Newswise. More than 7,000 journalists get the Newswise wires. Visit newswise.com and find out how to spread your news today.